All right, thanks you guys. We're excited to be up here tonight. Our systematic review presentation is on effective phantom limb pain treatment. I'm Heather Dalrymple, for those of you who don't know us. This is Dan D'Angelo and Stephanie Perry-Bordeaux. On behalf of all of us, I'd like to thank you for coming to our presentation, and we are more than willing to ask or to answer any questions that you may have at the end of our presentation. Our presentation is a result of a semester-long process of research and study that all began with determining a topic that would fulfill our goal of a topic that would be of interest to us as students, but also influential in educating for our future as practicing occupational therapists. We determined that phantom limb pain and an effective treatment would be an appropriate topic that would fulfill our goal. So before we dove into the thick pile of possible articles fulfilling our purpose of the systematic review, we knew that we needed to identify any potential constructs, or more simply for those of you who don't understand that, terms that would fulfill our goal for an effective systematic search. So the terms that you see in this diagram here are the terms we found most relevant to our topic of effective phantom limb pain treatment when we went into do any research on it. As a group, we feel that each of these terms are important, but obviously due to our time constraints, we're just going to go over a few of them. So the first one we felt that would be most important is amputation. It's a little bit further down the list, but amputation just means it's a partial or complete removal of a limb, and just keep in mind that this doesn't have to be something that's acquired. It can also be a congenital disorder. And then phantom limb, which is on the top, is the feeling of pressure or paresthesia on the amputated stump, as if it were coming from a leg, as if it was coming from an actual leg, but the leg was already amputated. Phantom limb pain, which is often abbreviated as PLP, which you can see up there as well, is a mild to extreme pain that's felt in the area where the limb had been amputated. And then our whole purpose of our entire thing is on the effective treatment. So down on the list there is mirror box therapy, which is also referred to as mirror therapy. And it's a technique that provides visual feedback using a mirror box to accelerate recovery from an amputation of a limb. And we'll show a picture of that here in just a minute. And then there's another common therapy that we also researched, which is called transcutaneous electrical nerve stimulation, or otherwise known as TENS. And it's the application of mild electrical stimulation to the skin via small electrodes. So at the beginning of our research process, we identified PLP, or phantom limb pain, is not a common condition that we will see as occupational therapists, but we were certain we would need to be aware of this kind of condition, such as PLP, to treat any possible clients that we may have. As a result, we knew it would be important to define a hypothesis of what we felt was most important to determine our systematic review purpose. We discovered through the available research, which was limited, that the most common techniques used to relieve PLP would include mirror box therapy, TENS, and as well as pharmacological therapy, which we didn't really dive too much into. With further research and our gained knowledge of the available techniques, we determined our hypothesis would be what we expected we would expect mirror box therapy will yield optimal results in decreasing phantom limb pain in comparison to TENS. And to explain this picture further that I have up here, this just is, which some of you will learn a little bit more in neuroanatomy next semester. It's just a mirror box therapy induces the development of neural pathways. It's also known as neuroplasticity, to trick your mind or trick the person's mind that the leg is still there.
Okay, so the purpose of our study was to determine which treatment was most effective in helping clients with phantom limb pain. And through our research, we found that the two major types of treatments for phantom limb pain included TENS, as mentioned, and also mirror box therapy. And so we were just wondering, as future therapists, if we were presented with a client who had phantom limb pain, what would we do for them, and how would we know which treatment would be best? And so that's kind of where we came from when we were doing our research. We really just wanted to know which type of treatment would be most effective, or if there was even a difference in findings. And so knowing the best treatments obviously helps clinicians provide the best treatment with the best outcomes for their clients. So some of the statistics, we kind of all are familiar with how statistics work. They're all over the place, but some of the statistics we found was that there's about 158,000 people who undergo an amputation in the United States every year. And causes for amputations include traumatic injury, peripheral vascular disease and infections, and there's obviously other causes as well. And phantom limb pain is reported to occur in between 64 and 85% of individuals who experience the loss of a limb. So it's very likely that if somebody has an amputation, that they're going to experience phantom limb pain throughout the course of their recovery. And this is an important area to study because chronic phantom limb pain can negatively impact somebody's ability to engage in occupations. If somebody's in chronic pain all the time, it's going to reduce their quality of life and their ability to participate in their desired occupations. So there's a couple of theories that go along with mirror box therapy and TENS. I'm going to just touch on the two major ones that we found in our research. So mirror box therapy is based on the visual proprioceptive dissociation theory. And so basically what this theory says is that there is a mismatch between your visual system and the proprioceptive inputs that are coming from your body. So basically the cortical pathways that are attached to that limb are still in place even though your limb is no longer there. And then your visual input is showing that there is no limb there. And so that disassociation is what's causing the pain, according to this theory. And based on this theory, it is believed that mirror box therapy relieves phantom limb pain because it resolves the visual proprioceptive disassociation. And then for TENS, the main theory behind this is cortical reorganization. And so cortical areas of the brain that were associated with the limb prior to the amputation can be taken over by other parts of the body. And so a lack of afferent signals to the cortical area allows it to be taken over by another part in this part of the body, which results in the phantom limb pain. So based on this theory, TENS is effective in treating phantom limb pain because it provides afferent signals that prevents this reorganization from happening. And so from what we kind of found in our research was that a combination of these two theories that focus on the central nervous system and the peripheral nervous system, combining them will probably give us the best results in treatment. Because we know that some individuals are born without limbs, so congenital limb loss, and these individuals still have reported phantom limb pain in their lifetime as well. And so we can't just say it's just from the central nervous system or it's just from the peripheral nervous system, because it can be caused by both. So the best treatments will probably incorporate both of these theories together.
So the main findings that we found in regards to mirror box therapy, as you can see from these pictures, mirror box therapy usually involves using one longer mirror, or you can have a box that has multiple mirrors within it. And as we have kind of discussed, the idea is to reflect the unaffected limb, which makes the brain believe that two full limbs are present, rather than one full limb and then the amputated limb. And then we looked at 8 studies that were conducted to measure the effectiveness of this form of treatment, and all of them proved to have significant positive results with treating PLP. We actually had difficulty finding research that didn't have positive results using this form of treatment. Furthermore, many studies found that after just one treatment session, the PLP symptoms were already decreasing significantly, so it didn't even take numerous sessions. It had a pretty instantaneous result. Overall, mirror box therapy proved to be a low-cost, holistic treatment that effectively decreased pain and increased the client's self-efficacy and sense of control regarding their condition, and it also decreased dependence on medications such as opioids. However, there's no specific protocol for using this in regards to frequency and duration for this form of treatment. And these pictures for TENS. TENS units come in various shapes and sizes, but in general, they will all have different electrode pads that will be placed somewhere on the body. The use of TENS for PLP is often the first line of treatment used to treat this condition. However, what we found were inconsistent findings with the lack of promising results. We looked at 10 different studies that used TENS as treatment for PLP. The first thing that we had discovered was the lack of consistency as to where they were placing the electrodes. Some studies believed it was best to place it on the residual limb where the amputation occurred, while other studies believed it was best to put it on the contralateral leg, or the unaffected leg or arm. And then there was even some studies that were trying to find a connection between placing the pads on the auricular area, which is the ear area. Another aspect that makes TENS difficult is that the use of the frequency, the amplitude, and the duration of treatment will vary from person to person. So there's no protocol for what's considered to be an effective level of treatment using TENS. And as a therapist, that means working continuously with this machine with your client over numerous sessions to figure out what they find to be an effective level of treatment. And this can also be very discouraging for clients because if they're not getting promising results right away, then they're less likely to continue with that form of treatment. Overall, there was no significant difference in phantom pain in clients using TENS versus clients who did not. If improvement was reported, it was very minimal. This information really made us question why so many therapists would continue to use this form of treatment when there's a lack of evidence to support it. Because research has demonstrated a positive effect on pain reduction by the use of Mirrorbox therapy, we strongly believe that this could help our future clients who are amputees. Being able to offer them a form of inexpensive pain-relieving therapy that they can perform at home would allow the client to gain more independence and control over their condition. Subsequently, this reduction in pain would also lead to a higher level of motivation to participate in daily activities and possibly allow them to return to leisure and social activities as well. During an OT treatment session, Mirrorbox therapy can be used as a preparatory activity, a topic for client education, or can even be used as a home exercise program. As OTs, it is important for us to remember that what works for one client may not work for someone else. So being able to offer this form of treatment to someone who's not seeing results with medication alone can sometimes make the world of difference for a client. Which brings me to this picture. Pictured here is our group with my good friend Jeff. He's traveled all the way from North Carolina today to share his story about becoming an amputee. He's also going to talk about his experience with phantom limb pain and Mirrorbox therapy. So please join me in giving him a warm welcome as he comes up to take the mic.